Dear students, I am Dr. Indira Priyadharshini, Associate Professor, Department of Oral Pathology, Vinayaga Mission Chankracharya Dental College, Salem. Today we will be seeing about epithelial pathology. Move on to the topic, oral potential malignant disorder. Oral potential malignant disorder is the condition that precedes the onset of invasive cancer of the oral cavity. The terms embrace from oral cancer lesion and condition. It is referred by the World Health Organization. Leukoplakia, lichen planus and oral lichenoid reaction, oral erythroplakia, oral submucous fibrosis, proliferative verrucous leukoplakia, they are among the most of the common lesions. Precancerous lesion. The precancerous lesion is a benign morphological altered tissue that has a greater than normal risk of malignant transformation. What is a morphological altered tissue? In which oral cancer is more likely to occur that apparently it's a normal counterpart. These are the precancerous lesion: leukoplakia, erythroplakia or palatal lesion in reverse mucus. Precancerous condition. Precancerous condition means a generalized state associated with significantly increased risk of cancer. A disease or the patient that have a habit does not necessarily alter the clinical appearance of the local tissue, but it is also associated with greater than the normal risk of precancerous lesion or cancer development in that tissue. Precancerous conditions are oral submucous fibrosis, actinokeratosis, lichen planus or discoid lupus erythematosus. Potential malignant lesion. Not all the lesion and condition are described on this term may transform to cancer. Rather, there is a family of morphologically altered among us, which some have a initially potential for malignant transformation. These are also indicates the risk in future malignancy elsewhere or not only the specific predictors. Precancerous lesion and condition by WHO in 1978. The precancerous lesion is leukoplakia, erythroplakia, palatal lesion in reverse mucus. Precancerous condition, that is oral submucous fibrosis, actinokeratosis, lichen planus or discoid lupus erythematosus. Today we will be seeing about the topic of precancerous lesion, that is leukoplakia. First we will see about the definition in WHO in 1978. They describe the leukoplakia as a white patch or plaque that cannot be characterized clinically or pathologically as any other disease. And next, in WHO in 1997, they say that predominantly the white lesion of oral mucosa that cannot be characterized as any other definable lesion. In WHO 2005, they found it is not defined, not distinction made from other white patches. So what is the etiology of this leukoplakia? The precancerous lesion, the leukoplakia, main reason etiology is tobacco. 80% of the patient with leukoplakia, they will come with tobacco habits or smokers. Heavily smokers, their number of cigarettes will be increased. Of the lesion may be the larger than the light smokers. Stop smoking, either it disappears or becomes smaller within the first year of habit cessation. So the smokeless tobacco, it is distinct with white oral plaque. It is mainly the patient using tobacco pouch. This is called tobacco pouch keratosis. The tobacco pouch keratosis mainly caused by the habit of tobacco and betel net. So this is the case of tobacco pouch keratosis. Here in buccal surface you can see the lesion as a tobacco pouch area. Coming to the other etiology of leukoplakia, that is UV radiation, ultraviolet radiation. The leukoplakia of the mainly seen in lower lip vermilion. Okay, mainly seen in the lower lip vermilion border and also associated with actinic chelosis. Actinic chelosis is nothing but the ulcers are seen only in the corner surface of the lip. This is called actinic chelosis. It will be seen in immunocompromised person, especially the transplants patients prone to develop the leukoplakia or squamous cell carcinoma of the lower lip vermilion. And then microorganism for leukoplakia, that is Treponema pallidum. It is produced the glossitis in later stage of syphilis. the tongue stiffness and excessive dorsal leukoplakia that can be seen in the syphilis patients. And Candida albicans, Candida also one of the reason of getting leukoplakia, and viral HBV 16 and 18 play the major role of leukoplakia. Coming to the other etiology, that is nicotine stomatitis, that is persist of 1 month duration after stoppage of the habit. Okay, this is mainly, here you can see the mainly seen in the palatal region. Palatal region, can you appreciate the palatal nicotine stomatitis? This is a very severe case of nicotine stomatitis, and also the other etiology of leukoplakia that can be because of the frictional keratosis. This is the frictional keratosis area in the buccal surface. Coming to the clinical types of leukoplakia, it can be a mild or thin leukoplakia, homogeneous or thick leukoplakia, either it can be a granular or nodular leukoplakia, verrucous or verruciform leukoplakia, proliferative verrucous leukoplakia, erythroplakia, that is speckled leukoplakia. Erythroplakia in the sense, erythro means erythematous. So you can see the leukoplakia as a white patch. So erythroplakia, it's a mixture of white and red lesion. Erythematous lesion along with the white patches, that is called erythroleukoplakia. It can be called as a speckled erythroleukoplakia. That is, it can be mixed with scattered patches of redness and white. It is a greatest risk of malignant transformation. So main signs and symptoms of leukoplakia, it's basically a grayish colored patches that cannot be wiped off, and irregular textured or flat textured patches in the mouth, the areas in the mouth that are oddend or thickened. Okay, raised red lesions are called as erythroplakia, and red patches along with the white patches called erythroleukoplakia. Pain when the lesion comes in contact with any acidic or spicy foods. So these are the example of different types of leukoplakia, that is homogeneous. This is the example of homogeneous leukoplakia. This is the example of non-homogeneous leukoplakia. Homogeneous leukoplakia will be white or well demarcated plaque with identical pattern throughout the entire lesion. Here you can see the white color patch throughout the entire lesion. A non-homogeneous lesion, it is present as a patches or plaque or intermingled with red elements. It is often termed as a erythroplakia or speckled leukoplakia. It is increased chances of getting malignant transformation. So this is the other example of erythroplakia. Here you can see only the red lesion. Here is the example of verruciform, verrucous or verruciform leukoplakia. You can see the proliferation of verrucous leukoplakia here. So this is the schematic picture of how the normal mucosa that can be transformed to leukoplakia or a thick fissure leukoplakia or granular or verruciform leukoplakia and erythroplakia. These are the different types of leukoplakia you can see. This is a normal mucosa. In thin leukoplakia, you can see only hyperkeratosis, acanthosis and lymphocytes. And think fissured leukoplakia, along with hyperkeratosis and acanthosis, you can see some dysplastic feature. Either it can be a mild or moderate features. Granular or verruciform leukoplakia, you can see the irregular hyperkeratosis. It is a verruciform. You can see the projection of hyperkeratosis and also the bulbous retiridges and lymphocytes. Dysplastic features will be moderate, severe dysplasia or congested vessels, and candidal hyphae may be seen in this condition. Erythroplakia, erythroleukoplakia, that is mixture of erythematous lesion and white lesion. It is also called speckled leukoplakia. In this condition, histopathologically, you can see the irregular hyperkeratosis, bulbous and crowded retiridges, and epithelial atrophy. On the right side, you can see the epithelial atrophy and lymphocytes. Either it can be a moderate or numerous lymphocytes, and severe dysplasia. You can see the lot of dysplastic cells within the epithelial surface. And also it's prone to carcinoma in situ. In next slide, I will be explaining about what is mild dysplasia, moderate dysplasia and carcinoma in situ. Okay, so next. So this is a best example of leukoplakia. It's a smaller lesion. It can be a smooth or wide demarcated lesion. Seldom shows dysplasia on the biopsy. It's a smaller lesion. When you take this biopsy, when you see under the microscope, you can see the dysplastic features. It may disappear or continue or unchanged. It is the initial stage of leukoplakia. This is the best example of severe leukoplakia. That is a diffused white patch. Here you can see the diffused white patch in the buccal surface. It is a corrugated and fissured white surfaces. It is leathery to the palpation. When you palpate, it will be leathery in consistency, and the fissures may deepen or become numerous. Most of the lesion remains the same, and some regress and some disappears, and somewhere become more severe and become nodular. This is a severe leukoplakia example. This is the type of leukoplakia, that is a nodular type of leukoplakia. It is an increased surface irregularity, you can see. And this is an example of verrucous leukoplakia. It can be called as a verrucous or verruciform leukoplakia. Here you can see the sharp and blunt projections in the surfaces. Proliferative verrucous leukoplakia is a special high risk form of characterized by the development of multiple keratotic plaques with roughened surface of projection. It can be like exotic in nature, passes through the phases of verrucous carcinoma to oral squamous cell carcinoma. Here I will be showing the picture. Here is the best example of proliferative verrucous leukoplakia. So here I will be teaching about the histopathology. Before going to the histopathology, I just want to tell you the normal mucosa. This is the normal mucosa. Here you can see the non-keratinized mucosa with connective tissue, salivary acini and muscle. These are the things we read it in first year under basic science. Okay. So the normal tissue, normal mucosa, how it is transformed to pathology. So next, this is a dysplastic epithelium. Here you can see the difference of normal epithelium and the dysplastic epithelium. This is a abnormal squamous cell. This is squamous epithelium. Here it is the basement membrane. Here it is the connective tissue and muscle fibers. This is the features of epithelial dysplasia. You can see the enlarged nuclei and cells, large and prominent nucleoli, an increased nuclear to cytoplasmic ratio, hyperchromatism. Excessive hyperchromatism is excessively dark staining of nuclei. Pleomorphism, that is abnormal shaped, either it can be from the nucleus or cells. Dyskeratosis. Dyskeratosis means it is a premature keratinization of individual cells. It will be appear as a pink in color. And increased mitotic activity. The number of mitosis will be increased. Abnormal mitotic figures, either you can see the tripolar or star shaped mitosis or mitotic figures above the basal layer can be seen. And other features, presence of more than one layer of cells having a basaloid appearance, bulbous or teardrop shaped retiridges. Loss of polarity. Loss of polarity means the lack of progressive maturation towards the surface. You can see the irregular epithelial stratification and keratin or keratin pearls. It can be a focal or round location of concentric layered keratinized cells. It will be appear as a eosinophilic in color. Loss of typical epithelial cell cohesiveness. So this is the epithelium which have a hyperkeratosis and hyperchromatism. Here you can see the severe cases, you can see the mitotic figures and individual cell keratinization. You can see the pink color keratinization, that is a eosinophilic keratinization. This is intercellular edema that can be seen in spinous layer. So the better understanding, I have added the schematic diagram of epithelial leukoplakia pictures. Here you can see the pleomorphism and here you can see the mitotic figures. Hyperchromatism, here you can see the retiridges that showing a bulbous retiridges. Here you can see the pleomorphism, bulbous retiridges, This is the best example of mild dysplasia. You can see the hyperparakeratinized epithelium with the nuclear hyperchromatism. Here you can see the basal cell hyperplasia. You can see the basal layer that shows the hyperplasia and acanthosis, and you can see the drop shaped retiridges. In severe cases you can see the bulbous retiridges. In mild leukoplakia you can see the drop shaped retiridges. In connective tissue with inflammatory cell infiltration. Coming to the histopathological diagnosis of leukoplakia, the mild epithelial dysplasia, it's basically the altered limited to basal and parabasal cells. Moderate epithelial dysplasia, the alteration from the basal layer to midpoint of the spinous layer. Severe epithelial dysplasia, the alter from basal layer to above the level. So above the midpoint of the epithelium. Carcinoma in situ, that the entire thickness of the epithelium is involved. So the top to bottom, you can see the dysplastic changes, but no inversion. There is no inversion, it is only within the epithelial surface. So this is the best example of normal epithelium transforming to very mild to mild dysplasia, and here you can see the moderate dysplasia, the changes, and severe dysplasia. Here you can see the carcinoma in situ. Here you can see the dysplastic epithelial changes from the top to bottom of epithelium. Here you can see the minor invasive carcinoma. The same picture which I showed initially, I am explaining it again. Here now you can have a better understanding with the normal mucosa, how the normal mucosa appears, and this is a thin smooth leukoplakia, hyperkeratosis, acanthosis and lymphocytes, and thick fissured leukoplakia. You can appreciate only hyperkeratosis, acanthosis and lymphocytes occasionally, and you can see the mild or moderate dysplasia feature. And here you can see the vericiform leukoplakia or granular leukoplakia. In the same, you can see the irregular hyperkeratosis in the form of vericiform pattern. Here you can see the projection like vericiform hyperkeratosis and bulbous retiridges and lymphocytes, moderate to severe dysplasia, congested vessels and candida may be present. In erythroleukoplakia, it is also called as a speckled leukoplakia. In speckled leukoplakia, you can see the irregular hyperkeratosis, bulbous and crowned retiridges, epithelial atrophy you can see, and lymphocytes along with severe dysplasia. Here you can see the severe dysplasia within the top to bottom of the epithelial layer, and carcinoma in situ. On the right surface you can see the severe dysplastic features along with the keratin formation. In this connective tissue you can appreciate the congested blood vessels. These are the best example of mild dysplasia to moderate dysplasia and severe dysplasia. So there is a mild changes. Here you can see the lot of epithelial dysplastic changes like pleomorphism, hyperchromatism and lot of mitotic activities you can see, and here you can see the lot of changes along with the keratinization. This is the best example of verrucous hyperplasia. Here is the verrucous hyperplasia, the projections, and this is the example of vericiform carcinoma, verrucous carcinoma. Okay, here this is the best example of histopathological pictures of verrucous hyperplasia. This is the example of verrucous carcinoma. So coming to the classification of modified classification of a stages system for leukoplakia. This is given by Wander et al. In 2000. L1, that is the size of leukoplakia, is greater than 2 cm, and L2, the size of leukoplakia, that is 2 to 4 cm, and L3, the size of leukoplakia is greater than 4 cm. Lx, that is size is not specified. P, that represents the pathology. PO, there is no pathology, no epithelial dysplasias identified in particular case, and P1, that is distinct epithelial dysplastic features identified. Px, dysplasia is not specified in the pathology report. So this is the OLEP staging system. It's stage 1 that consists of L1 and PO, stage 2 that is L2 PO, and stage 3 that is L3 PO or L1, L2 and PO. Stage 4 that is L3 and P1. So coming to the prevention of leukoplakia. So avoiding the tobacco, including the chewing habit or smokeless tobacco, we have to advise the patient to quit the habit. And also we have to tell the patient to limit your intake of alcohol. And healthy diets with a lot of fruits and vegetables and vitamin A and beta carotene supplements may help to improve the condition. So the leukoplakia treatment, usually removing the sources of the irritation, mainly quit the habit, either it can be a smoking or tobacco chewing or excessive alcohol use or any dental causes. If the leukoplakia is caused by any dental problems made to the dentist for correction of a ill-fitting denture or jagged tooth and other underlying causes, it can be corrected. However, this is a positive with a biopsy result. The further treatment is necessary. The treatment of leukoplakia is more effective after early diagnosis. So the immediate removal of all leukoplakia to stop the spread of cancer is maybe done with laser or scalpel or cold freeze method with a probe. You can suggest the cryoprobe method and use of prescription of any antiviral medication of this diagnosis like hairy leukoplakia. And we have to keep it in mind that after leukoplakia patches removed, there is still increased risk of cancer. So if in any case you will need to regular follow-up visits to check for recurring the symptoms of leukoplakia which are common, and also you have to follow up the patient for further investigation. Thank you.